We've always been able to talk to knowledgeable sources to find out more about the latest developments in healthcare. We've sat down with medical experts in both our Ask the Expert and Heart of the Matter segments to get in-depth answers about heart health, and our Well Beyond the Diagnosis stories look at the latest in cancer care. In today's Heart of the Matter, there are questions over new guidelines for treating blood pressure. Doug Johnson looks at the new rules and the questions doctors and patients will be dealing with.
Hypertension, or high blood pressure, is a serious problem for millions of Americans. It occurs when blood pushes too hard against the walls of the blood vessels as it flows through your body. That additional force is what damages the blood vessels, kidneys, and heart. Normal blood pressure for healthy adults is 120/80. Previous guidelines suggested that the goal for controlling high blood pressure was to get older patients' readings to less than 140/90. But new recommendations have changed that goal.
They bumped up that target to 150/90 for pretty much anybody above the age of 60 to 85. Above 85, we have very little data to help us determine what exactly is right for that population.
Under the old guidelines, more than 13 million Americans would have been considered to have uncontrolled high blood pressure. With the new guidelines, 10 years in the making, all those people are now meeting blood pressure goals. Dr. Shavkowski says that doctors may have some issues when trying to figure out how to treat their patients based on the new guidelines. A quarter of high blood pressure patients over the age of 60 could be eligible for reduced therapy or entirely different therapy to treat their high blood pressure. And he says because the rules are opinion-based, diagnosis and treatment may be less clear for younger patients.
What they also found was that for people below the age of 60, after reviewing all of the data, there's really no conclusive evidence that there should be a target for that population. With that being said, they did render their opinion, but all of this is based on opinions, not sound clinical, scientific, evidence-based medicine. And the opinion is that for people 60 or younger, one should target them for a goal of 140/90 or less.
Another finding looks at the medications used to treat high blood pressure and how some drugs don't work as well for certain people.
And for specific populations like African Americans, they felt that you should try to avoid ACE inhibitors and angiotensin receptor blockers because those have been shown to have little benefit in that population and in fact may be detrimental.
The American College of Cardiology and the American Heart Association will publish their own guidelines sometime in 2015. These guidelines were published earlier this year in the Journal of the American Medical Association. The authors say that while rules should meet the needs of most patients, they're not a substitute for a doctor's clinical judgment about the specific needs of each patient.
I think some patients who are being treated per the old guidelines may be left that way if they're doing fine, but the approach may be that going forward in those folks older than 60 years of age, doctors may not be as aggressive. And I think that in the end, the more experienced clinician will read the guidelines, understand them, but also take from his own experience and his own education as to how to approach his patients.
And it remains important for people to do their part to reduce blood pressure by eating better, cutting out salt, and getting enough exercise. For Smart Medicine, I'm Doug Johnson.